Good evening, everyone. Thank you all for coming to today's film event, and it's really great to see you all. I'm Liang Yufu, the librarian for Chinese Studies. Today's event is part of the China Ongoing Perspectives or CHOP Film series. For those of you who joined us for the first time, CHOP is a movie discussion series co-sponsored by the Lieberthal-Rogel Center for Chinese Studies and the Asian Library. And it's co-organized by my dear colleague, Carol Stepanchuk, and myself. CHOP series provides selected documentary films that view the Chinese-speaking world through those slices of reality on transitional and transcultural events and memories. If you have any questions about CHOP, or if you have any films you would like to recommend to us, please feel free to reach out to Carol and me. Today's event concludes the 3 consecutive nights with our artist in residence, director Hao Wu. Since this Wednesday night, we have been watching and discussing director Wu's recent works in chronological order. So today comes to his most recent film, 76 Days, which was released last year. Now, we are thrilled to introduce our own Emmy Award-winning director, Hao Wu. So Hao, could you please turn on your video, please? Thank you. Hao Wu is a technology executive turned filmmaker. Born and raised in China, he holds a Master's of Science degree from Brandeis University and an MBA degree from the University of Michigan Ross School of Business. From 2008 to 11, he was a fellow at New America, a DC-based think tank. He's a member of the documentary branch of the Academy of Motion Picture Arts and Sciences. Director Wu's documentary films have received funding support from the Ford Foundation Just Films, ITVS, Sundance Institute, Tribeca Film Institute, and the New York State Council on the Arts, and distributed his films through Netflix, Amazon Prime, Paramount Plus, PBS, and BBC, among others. His feature documentary, People's Republic of Desire, which we watched and discussed Wednesday night, is about China's live streaming phenomenon, and it won the Grand Jury Award at the 2018 South by Southwest Festival. Director Wu followed that film with All in My Family, a Netflix original documentary short that launched globally in May 2019. We just had a wonderful panel discussion last night about this film. And 76 Days, which is the topic of today's event, is the director Wu's most recent work. It is the first feature documentary on the COVID-19 pandemic to play at a film festival. World premiered at the Toronto International Film Festival in September last year. It was named Critics' Pick by the New York Times, shortlisted for the Academy Awards, nominated for the Gotham Awards, and won a Prime Emmy Award and a Peabody Award. So some of you may remember that director Wu brought one of his earlier works to Ann Arbor almost 6 years ago in 2015. The title of the film was The Road to Fame, which tells a unique coming-of-age story about a group of young students majoring in Western musical performance. That screening and Q&A event was also my first time to meet director Wu and get to know his art. Over these years, it has always been very exciting to see his wonderful and inspiring films released one after another. And it was even more exciting when the news came that he recently won an Emmy Award for 76 Days. So we are all so proud of you, and thank you very much, and go blue. Yeah.
Thank you.
Yeah, thank you. We really look forward to the discussion this night. So now I will hand the mic to my dear colleague, Carol Stepanchuk, and she will be sharing a few housekeeping items and introducing our special guests. Please, Carol.
Thank you, Liang Yu. And Director Hao. Greetings, everyone. And panelists, could you all turn your cameras on now? I want to remind you that the event platform for viewing 76 days is available through October 10th. All you have to do is register, and I think Liang Yu will post the link right here in the chat box for all of you. For those of you who haven't had a chance yet to see the film, Director Hao will be providing a summary and showing a short 8-minute clip that will certainly give you a sense of the intense dynamics of this documentary. And you can post your questions in the Q&A box following the discussion with our panelists, Professors Twila Tardif and Michael Imperiale. Now on with the program. I want to keep my remarks short so we can get to the heart of things. But first, a special opening for tonight's event is the Lieberthal-Rogel Center for Chinese Studies celebrates its 60th anniversary and its long and close relationship with China for over a century and a half. I'd like to bring in our interim director, Lan Deng, professor of urban planning and architecture at the U of M's Taubman College, to provide an introduction to a special guest that we have this evening. Lan, I'll hand the mic to you.
Thank you, Carol. So I'm Lan Deng. As Carol mentioned, I'm currently the interim director for the Lieberthal-Rogel Center for Chinese Studies. I'm very pleased to introduce our special guest tonight, our center's benefactor, Mr. Rich Rogel. Just like Director Wu, Mr. Rogel is an accomplished alum from the UM Rice School of Business. Mr. Rogel's achievements in business and philanthropy are numerous, far-reaching, and inspiring. He has been an especially strong and passionate supporter of clinical medicine and research in cancer biology, as well as Chinese studies at University of Michigan. And he has been advocating for medical research collaboration and partnerships between the US and China, which, as we have seen from the pandemic, is extremely important in addressing this global challenge we face. So we are very delighted to have him with us tonight to say a few words on those areas of his interest that are being spotlighted tonight through Director Wu's film, 76 Days. Glad to have you join us, Rich.
Thank you. I just lost 1 second, please. Okay. Thanks for having me. Tonight brings together several areas that I feel deeply connected to. I am delighted to see the interesting paths our alumni take post-graduation. In the case of fellow business school alum, Director Wu Hao, a successful Emmy-winning filmmaker. Mr. Wu highlights the complexities of China in 76 Days and in his other documentaries. And this is certainly something I appreciate. I have a deep interest in and love of China, and the Center for Chinese Studies efforts in forging academic exchange and research to help navigate the complex relationships between our two countries. I first went to China in 1993, and I have to say I fell madly in love with the people and with the country. And I have, until last year, I've been going back about 4 times a year and as many as 8 times a year. One of the things I learned on that first trip with the former ambassador, he said, you know, sometimes our governments don't get along, but the people love each other. And Ambassador Woodcock gave several very important examples of how that works. I'm very proud to co-chair a joint institute between Peking University Health Science Center, which is easier to call BAE, and the University of Michigan Medical School. This has produced tremendous research, and in 2020, it produced tremendous benefits for both sides of the Pacific. Peking University Health Science Center at BAE sent about 400 professionals, doctors and nurses, to Wuhan, and they stayed in constant contact with the department chairs at Michigan Medicine to tell us what they learned and to ask for some help in understanding certain things. But what that allowed us to do was to treat our patients better. And it was just a tremendous joint effort and showed the value of joint education and joint research. Wu Hao's film, 76 Days, especially captivated me because it showed the resourcefulness, the spirit, the strength of the people who dealt with both sides of the epidemic. Those who caught the disease and those who had to treat them. I was absolutely moved by the people who were shown in that film. And for those who haven't seen it, this is just something that happens at the end. But when Liang was telling the daughter of the woman who died that her mother had passed, and they hugged each other, I wanted to hug her and stop her from crying. It was such a powerful moment. And it's an incredibly important film, non-political. It just showed the strength of humanity and how we have to work together. Here's a film that looks at pivotal moment in global history with compassion and truth, and touches on the need for conveying landmark scientific innovation and information to the public. We sometimes forget that this is a novel virus, and that meant it had never been experienced before. And the difficulties in dealing with the patients, and especially in Wuhan, when nothing was known about this, except that there was this new form of pneumonia. And I think it showed with the people and their caring and their exhaustion. My heart goes out to them. There is a real need to understand the biology underlying the origin of the COVID-19 virus on a basic scientific level, as well as a transnational level. And I think our panelists today will help pave the way to understanding some of the psychological, cultural, and scientific issues underlying the pandemic. Thanks for inviting me today and having me join in today's conversation. Now I'll pass the microphone back to Liam.
Thank you so much, Rich, for your powerful opening remarks and for sharing your personal experiences. And also thank you for your years of generous support to both the cancer research and Chinese studies. So I will now turn to our program. And since Liang Yu already introduced the Director Wu, I will briefly introduce our other two panelists, Professor Mike Imperorini and Professor Twila Tardif. And you can find their full bios at the LRCCS website. Professor Mike Imperorini is the Arthur Thurnau Professor of Microbiology and Associate Vice President for Research Compliance at the University of Michigan. As a virologist, his research focuses on the study of DNA tumor viruses, and his work has made important contributions to this field. He has also served on various national committees addressing the issues of responsible conduct of research, dual-use life sciences research, and the intersection of science and security, and has published extensively on those topics. So now Professor Twila Tardif. Professor Tardif is a professor of psychology and Chinese studies at the University of Michigan, and she was also the former director of LRCCS. And I enjoyed working with you, Twila, last year. So her research interests include cross-language comparison of Chinese and English. She has recently been involved in research on COVID-19 across the globe that looks at worldwide anxiety about the disease, prevention efforts, vaccination, and blame. So to start off the discussion, we will hand over the program to Director Wu first, who will give us a brief summary of the film with a film clip that captures the highlights of the documentary 76 Days. Please, Director Wu.
Thank you, Len, for the introduction. Thanks so much, Rich, for everything you've done to improve the US-China relationship and also enhance the mutual understanding between the two peoples. I think with 76 days, it's really hard to look back and speak about the film because every time I watch it, I talk about it, like I tend to get choked up, just like Rich did. When I started making the film, a lot of times as documentary filmmaker, we keep on asking ourselves the question, why we decide to work on the film? Why we decide to spend a couple years of our life to focus on a particular subject in order to make a film. I think a lot of times is that because the subject matter resonated with me deeply. With 76 days, I started researching and making the film in early February last year, when Wuhan was already under lockdown, but at the same time in New York, everything appeared to be completely normal. Nobody was wearing masks. But I feel like as a Chinese filmmaker based in the US and working in the US, it's the story about the people I still have many emotional connection to. Their suffering, their stories. A lot of time there's voices that cannot be heard across the ocean that drew me into researching this and started making this film. And then a year and a half, more than a year and a half now, after I started making this film, I think the entire world has been impacted by COVID-19. We all have our own personal story to tell about COVID-19. I just feel extremely fortunate. My team has been able to really push out the film in Q4 last year as one of the first films to tell the world about what really happened on the COVID frontline. To tell the world about the story in Wuhan and how particularly Chinese it is, but at the same time, so it's also such a universal story. So I'm pretty sure we're going to get into more detailed discussion about the making of the film and also the meaning of the film. But I think maybe for the participant here, some of you have not been able to watch the film. So maybe we can first watch a select clip from the film first before we go into discussion.
Professor Imperiale, thank you for sharing Dr. Wu. I think it's really kind of very touching, moved. Okay. So Professor Imperiale, could you share some of your reflection?
Great, thank you, Lan, and I want to thank you for inviting me to be part of this discussion, and especially thank Hao for filling this compelling story. You just saw two very moving clips that are two of many in this movie. So I'd like to set the context for my remarks by giving you my recollection of what the virology and public health and infectious disease communities were thinking when COVID-19 first arose at the end of 2019. I think many people hoped that this would play out similar to the first SARS outbreak or the MERS outbreak, with the ability to isolate infected individuals and quarantine their contacts and thereby stem the spread. But of course, there was a problem with this assumption, as we came to know, as it applied to SARS-CoV-2, which is that this virus could be transmitted by asymptomatic individuals. And thus, the public health system was not, and I would argue it could not be, prepared for what was about to transpire. And as such, we had to learn about this virus and disease in real time. So to me, this ability to transmit by asymptomatic individuals, together with this being the introduction of a new virus into an immunologically naive human population, were the two major factors influencing the initial course of the pandemic. And as I viewed the film, it brought back these memories of what I was experiencing at the start of the pandemic here in the US, based again, not only on my experience as a virologist, but also what I had learned over the years about the response to infectious disease threats. And it was not surprising to me to see how the teams in Wuhan were trying to respond in the early days, but it was enlightening to see it being recorded rather than simply hearing or reading news reports. The first thing that struck me was the sense of uncertainty. What exactly were we dealing with? What was the best way to respond? Especially striking to me at the beginning of the film was a scene where the patients were crowded behind a locked door trying to get into the hospital to be taken care of. It was obvious that these individuals were desperate. The healthcare workers were trying to do their best, and their sense of urgency was palpable. One could also sense a little bit of desperation on their part, however, likely contributed to by the uncertainty being faced with a new disease and not knowing how much risk they themselves were potentially exposed to. But I also sensed frustration in the healthcare workers, frustration that they couldn't immediately take care of everyone and comfort everyone, as you saw in one of the clips that Hao just showed. And so this and their compassion were the themes that ran through the film. The other thing that was stark at the beginning of the film was the contrast between the energy and what sometimes seemed to be chaos in the hospital with the quiet and empty streets outside. And so these scenes reminded me somewhat of the spring here at the University of Michigan. At one point in time, we had upwards of 250 COVID patients in our hospital, which caused the administration to begin planning and setting up a field hospital in one of the athletic facilities. Fortunately, Governor Whitmer declared a state of emergency that closed many retail businesses, made masks required indoors in public places such as supermarkets, and imposed distancing requirements. These measures, however, were nowhere near as strict as the lockdown that happened in Wuhan, and I can only imagine how much more difficult it was for the residents of Wuhan. But of course, as the film progressed, we saw routines being established, people seemed a little bit less hectic, and there was a transition to where the healthcare workers were able to start to get to know the patients as fellow human beings, each of whom had a unique life and story to tell. The scenes outside the hospital at that time also started to show more activity on the streets. And so it was sort of a transition point. And ultimately, the situation reached the point at which workers were actually being able to take a moment to relax. And so in addition to these big picture themes, though, I was really fascinated by the stories of the individuals in the movie. The first was the gentleman that the staff called Grandpa, whose story we saw progress through the film. Throughout, I really wondered, was he really infected? But what was really fascinating to me was to see him change from a bit of a curmudgeon to someone who seemed resigned to accept his having to be in the hospital, while at the same time the staff changed from seemingly having to argue with him all the time to being able to have calmer discussions. And so to me, this was just a microcosm of what was happening with respect to the pandemic writ large, a gradual understanding of what was happening, allowing everyone to switch from crisis mode to more normal day-to-day interactions. And it was also really fitting to me that he seemed to leave through the same door through which the residents were clamoring to get into the hospital just a couple of months earlier. A very, very powerful scene. The second personal story that resonated with me was that of the pregnant woman. One can only imagine the terror she felt when her baby had to be whisked away to the neonatal intensive care unit, something I'm assuming was done as a precautionary step, because once again, at that time, no one knew what to expect. And then when she was discharged, she and her husband had to quarantine before the baby could be released from the hospital and they could begin their life as a family at home. The way that the scene in which they waited for the baby to be discharged outside the NICU, and that scene lasted a while. And to me, that was a great way to drive home their level of anxiety. And again, this was a microcosm of what was happening in society, and that we were all anxious in a situation in which we had no clear answers, and sometimes no answers at all. The end of the film was also striking to me with respect to the contrast it presented with the beginning. As I noted earlier, the beginning was characterized by urgency, a lot of action, while at the end we saw things like artifacts that were left behind by the patients who unfortunately succumbed to the disease, and the rooms and the beds that were left empty. And these views of the inside were once again in contrast to what was happening outside, which was a return to some normalcy with people being more active. And of course, embedded in this return to normalcy was the scene that you just saw in which Lee had to call families who lost their loved ones. And one can't help but wonder if this ending was a metaphor for the likelihood that we will never be rid of SARS-CoV-2. There's always going to be something that will need to be done. And I couldn't help but ask myself also, is it a coincidence that the Wuhan lockdown ended as spring was emerging? That was really uplifting to me in many, many ways. And so overall, I really enjoyed the way this film captured the essence of the early days of the pandemic. Viruses can only replicate in living hosts, and those hosts are part of the community in which they live. So therefore, the trajectory of a virus and society are intimately linked. And this virus threw humanity a curve, and we're really a fortunate species to have the desire and the willpower to defeat such challenges, work together, and also to have the resiliency to survive them, as was demonstrated in this film. So thank you, Hao, for doing this. It was really a wonderful experience for me.
Thank you, Mike.
Twila, would you like to share yours?
Yeah, I'll start by adding to the gratitude that I feel for you having made this film, and for all of the doctors and patients who allowed you to be there during those moments. Those were incredible moments in people's lives, and the fact that you were allowed to be there and watching those moments without narration was absolutely breathtaking. So I like to think of Wuhan as my second home. It is the first place that I landed in China ever, back in 1988. And it has always felt like the place that I could go back to. And so when I first heard what was happening in Wuhan, I was just dumbstruck. And I was also stunned by descriptions I was hearing from friends, and friends who had family in Wuhan, as well as friends in other places in China. And to be able to just see this play out in a very humane, understandable way. So I do research on Chinese children and families, and what I saw was family relationships, and even the calling nai nai and calling ye and calling ai, and just that bonding of familial relationships in that caregiving situation with the doctors and nurses and all of the people who were trying to take care of the patients, completely overwhelmed. And yet, and one of my favorite scenes, actually, it was such sadness, and at the same time you managed to capture so many moments of humor, where the son is yelling at his father to be a good communist member and to not be slacking off, was such this moment where he got all worked up and stopped crying briefly, and just to watch those moments that you captured so beautifully was astonishing to me. And I'm still, I feel like I need to keep watching it. And again, the baby as well, I was just so worried for that baby, and so worried waiting for that call to come from the hospital, that the baby was okay and that they could go pick up their baby. So my main comments are just thank you, but I do want to hit home something that I had to just keep shaking my head over and over again. So it's over a year and a half now. And I walk outside, we have vaccines, and people are still not wearing masks. And I look at the amount of protective equipment that was going on in those rooms, in the corridors outside at the time, and to think about what would have happened if Chinese people had been acting like people in this country, and the complete disaster that was averted thanks to the very strict rules, the very, very careful use of protective equipment, and people really caring and looking out for each other. That to me was a very big take-home message. And I hope that along with all of the advanced science that we're able to put forward, that people continue to remember that there are really straightforward, simple things that saved many, many lives. So thank you again.
Great, thanks so much, Twila.
So Director, would you like to respond to their comments?
I think they are so articulate and pointing out some of the strengths in the film. I think maybe we can just start taking some questions. If Mike or Twila have questions as well, maybe we can lead with that. Or Rich, if any of you have questions.
How I do have a question. I would love to know what some of the words were that were written on the backs of the PPE of the workers.
Yeah, so those words are primarily people's names at the very beginning, because they're once you put on multiple layers of PPE, you cannot tell people apart. And later on, when medical teams started arriving in Wuhan from elsewhere in China, medical volunteers. So it's even more confusing. There are a lot more medical workers in the hospital. So really, they have to, in addition to names, they have to write their role. Are they a doctor or a nurse? Because in time of crisis, you need to grab a doctor, and it's probably some doctor you never worked with before. But later on, as you saw in the film, gradually become more lighthearted, right? Start drawing pictures when they have more free time in their hands.
Yeah, I was hoping that there would be more words of inspiration, because that was really touching to see that.
Yeah, they also write stuff they want to eat, the duck, the noodle, and the latte from Starbucks. Those are some frequent characters written on people's backs.
Yeah, I remember at that time, I was watching these images from WeChat, right, about how these medical professionals from other places were sent to Wuhan. And then, like how their families were reluctant seeing, their husband, their wives being sent to Wuhan. So talk about how their families struggled to make sense of this and eventually decided, this is what Wuhan needed. I remember seeing the image about how, one husband said when his wife was in the car, and he said, please come back safely. If you come back safely, I will do all the household chore for 3 months or something, or a year. I think it's a year. That was very, very touching. Yeah.
So maybe we can start taking questions from the Q&A.
Yeah, so let's see. We have some questions. I think the one question asked, how did you, Director Wu, get the permission to shoot real time in such chaotic conditions? Especially the last thing on collecting mom's death certificate and belongings, that was real time?
Yeah, so the production of this film was actually pretty challenging. I started researching this film in early February, I think a week or 10 days after the government announced the lockdown. At that time, first of all, the pandemic was evolving really, really fast. So my first instinct was to reach out to filmmakers and reporters who has already started reporting and filming on the ground in Wuhan. I reached out to over a dozen of them before I found my 2 eventual collaborators, because as soon as I saw their footage, I realized, first of all, these 2 are great cinematographers. They can capture nice images, but more importantly, the way they approach the subject, the style of their filming, truly empathetic, but also showing a lot of respect to the patients in front of the camera. I feel like that's something I would like to do myself as a filmmaker. So that's why I really, reach out to them, because we had never met before. So I reached out to them, talk over WeChat, and later on, when the situation became more tightly controlled in China, we started using Signal and Telegram to communicate with each other. But in the meantime, as the pandemic was evolving, so I started reaching out to filmmakers elsewhere as well, in Italy, in Spain, thinking and also in Japan. I myself began filming in New York when New York was locked down. So because originally I thought we could be making a global pandemic film, but later on, gradually, as I saw the footage coming in, I noticed that the most powerful footage was from Wuhan. That's when I decided to really focus this film on Wuhan alone and disregard all the footage we're getting from elsewhere. So I wasn't there. So I wasn't there filming. It's my two co-directors who are filming inside the hospitals. The reason why they could get such intimate access inside the hospital was both of them are reporters. Wei Chen, my co-director Wei Chen, he was a video reporter for Esquire China, but he actually wasn't sent by Esquire China to go do reporting because Esquire is a lifestyle magazine. That breaking news is not their beat. But Wei Shi is also an aspiring independent documentary filmmaker. So as soon as he heard Wuhan is being locked down, he reached out to some medical teams, talked to a couple, and finally through some family relationships, got introduced to one from Nanjing. And he pretty much embedded himself with the Nanjing team, and the whole team arrived in Wuhan. That's how he gained access to film inside the hospital. So whenever people ask him what are you doing here, he can always use his reporter card, like, I'm a reporter for Esquire China. And then my other co-director, Anonymous, he's a photojournalist for a local Wuhan newspaper. He was sent there to take photos to accompany the news stories about the lockdown. He himself had already known many hospitals because for reporting, for having reported stories in the past. And he had legitimate business to be there. But this is actually his first attempt at making films because he just felt so overwhelmed on the front line. He felt like photos by themselves were not enough to capture the intensity of what's happening on the front line. So he started taking, he's done some commercial or wedding cinematography before, but this is really his first time doing doing long form filmmaking. And so later on, even though China started really tightly control what kind of story can be reported, who get access to the hospitals, what kind of COVID narrative can come on with China, I think the control started tightening in mid-March. But since my two co-directors, they are reporters, they can tell people they have legitimate business to be there. And also another thing is that they have embedded themselves inside the hospital since February. So they have established trust with the medical team, with the patients. So they were allowed to film pretty much unhindered inside the hospitals. Remember at the beginning of February, once they say you can come inside and film, all the hospital asks them to do is to basically waive liabilities. So as long as the filmmakers agree not to sue the hospital, they can come in and film. And it was absolute chaos inside the hospital. Nobody has the resource or time to watch over the shoulder to tell them you can or cannot film this or that. So their access was short. I mean, even to this day, I think there's another film coming out. It's about hospital in Queens, New York. I'm really looking forward to watch that. So that film called The First Wave supposedly has also great hospital access. I'm really looking forward to watching that as well. Other than that, I haven't seen other films with great access inside the ICUs, which was one of the main reasons I decided to really narrow the focus, to focus on the story in Wuhan because of the quality of footage coming out of them.
So I had a follow-up question about that. Have the families who've been filmed or the ones who have been featured in your film, have they seen the film?
Yes, it took us a while to get, so it's complicated. So they watched the film really, really late because of the political sensitivity around any COVID-19 narrative coming out of China. Because my co-director Anonymous works for a state-owned newspaper, he was really afraid of, the government dislike the film, he may lose his job. So he opted to remain anonymous. So when we premiered the film at Toronto last September, we actually refused interviews from all Chinese language media. We wanted to limit, during the production of the film, before we premiered in Toronto, only 5 people knew this film existed. Because for a long time, we didn't know where the film was going, how political it would be. whether the Chinese government would have issues with it. So we didn't want anybody to know. Obviously, the participant, the people being filmed, they knew they were being filmed for a documentary film, but what the film was, they didn't know. We didn't show them the cut. But then once the film started traveling among festival circuit and also virtual cinemas in the US, once we hear people's response to it, we feel more comfortable. I think we started showing those people in the film end of last year, beginning of this year, letting them see the film. And I feel like all of them, some of them still have a hard time. Like, for example, the nurse whose father passed away in the beginning of the film, which is also the scene that shown, she still could not watch it. I mean, we offered it to her. She watched it a little bit. She just couldn't continue. Because for many people inside of Wuhan, I think they're still suffering from PTSD, right? It was such a sudden, lockdown that got suddenly imposed on the entire city. And then the Wuhan people went through so much hardship, especially in the beginning. I think they're still recovering.
So, yeah. I remember one of the scenes in the film was about the volunteer drivers that driving patients to the hospital, right? Because during the lockdown, there was no public transportation. So a lot of the patients actually had to rely on these volunteers to drive them to the hospital. I think that was, and I also heard that even some of these volunteers actually contracted the virus, and some of them actually passed away. So it's just great sacrifice for people, to trying to take care of each other, and how much, how brave those people were.
Yeah, absolutely.
And we have another question. I think, Director Wu, since now you are in the US and then, you did this film. So what's your personal experience about these different government measures that have taken to, to curb the spread of COVID? I think you now have this comparative perspective, right? You have gone through this personally, in both places, and at least doing the films. So can you offer some thoughts on this?
I think we have other experts on the panel. I can only offer my personal experience and my personal transformation, so to speak, while making this film. I started making this film just like most everybody. We were angry, right? We were angry back in February. We were shocked. We were surprised. We wanted to assign blame. We wanted to find out what went wrong, what have caused this to the outbreak in Wuhan to be so big. And I think at that time, the narrative about COVID was freedom of speech versus infectious disease control. That's the prevailing narrative back then in the Western media, at least. It's about how if only the local government didn't suppress the whistleblowers, things could have been a lot easier. And then when Dr. Li Wenliang, one of the early whistleblowers, passed away from COVID, I think most Chinese I know, I cannot speak for all the Chinese, most Chinese people I know were angry, right? Were angry. But then, so my first instinct while making this film was investigative. I wanted to work with my co-directors in Wuhan to find out what had contributed to this outbreak. But then fairly quickly, a couple things happened. One is that we realized it's almost impossible in a lockdown city to have two cameramen traveling around the city to do investigation. That's impossible. Secondly, anything we can get on camera, any whistleblowers willing to be interviewed, those story has been well told repeatedly to not only Western media, but also Chinese domestic media. There's nothing new I could add to the discourse about COVID. Thirdly, as I started, editing this film in late March, April last year, when New York was starting to be put under lockdown. That was a huge transformation in terms of my own thinking about this COVID. It's like, how could this be? How could US supposedly the best, we people in this country tend to think we have some people, right, like they tend to think we have the best political system, we have the best public health system. How could we fumble so badly in our, even after Wuhan was put on a lockdown for 2 months already, how could we still be so underprepared? So that kind of helped me think deeper about infectious disease and pandemic control and human nature. About, I also started reading a lot about past pandemics, Spanish flu, the Black Plague, and also AIDS pandemic. How each time when we're faced with a new virus, it's not just the political system, it's the society, it's the media, it's everybody. It's part of human nature to lack imagination of things they have not encountered. So I started thinking more and more about that. I'm starting thinking more and more about how premature it will be to pass judgment on any society's response to pandemic. Because at the very beginning, people were angry at China. And then fairly, even in February, there's so many scandals coming out of the lockdown in Wuhan. Chinese people were pretty angry, I think, a lot of them. But then starting in March, once the situation was put under control, people started thinking maybe the way the really almost draconian measure the Chinese government put on Wuhan, maybe that was the scientific way. Maybe that was the effective way. Maybe in the long term, that's more effective way. And then you watch, how Taiwan did well, right, for a long time, but recently Taiwan also started having issues. So I just feel like there's too early to make this political commentary. That's why as I started working on this film more and more, I try to move away from my initial motivation to do political analysis or news analysis to focus more on the common human experience. Because through the upheavals in the past year and a half, obviously we can focus on the differences between different societies responsive, but also we can focus on what's common, what's similar. I think, I don't know whether that is, sorry, it's a long-winded answer. I don't know whether that completely answers your question.
That's a great reflection. And I think really, I feel that this COVID experience really also speaks to how, two countries and people, living in two countries view what is private and what is public, right? And I think, what is the responsibility for the government to deliver some of these, public health is kind of very classic example about the public health safety is a public good, right? And I think, what individuals should be responsible for these public dimensions. So anyway, so we got quite a few questions here. And I think this is the question, for Director Wu. So I was fascinated by the fact that you allowed the story to tell itself. There was no narration and very little in the way of textual commentary. How did you arrive at that structure? Were there models for that approach? So it seemed novel to me.
Yeah, it was novel to me as well, because this film is very different from my prior films. My prior films were all character-driven, focused on a few main characters. It's very dramatic. It's edited almost like a traditional screenplay with 3-act structure. That's all my past films. But with this film, we try to do that at the very beginning. We try to identify who may be the main characters for my two co-directors to follow throughout the entire hospital stay. But later on, we quickly realized it's really hard to do that because it was so chaotic at the beginning. We didn't know who may be interesting, whose story might take we want to give time to develop. And also some of the patients we filmed, they were transferred to a different hospital. They may pass away, or they may be, if they recover quickly, they might be released very quickly. So in the end, I just told my co-director, just film as much as you can. But obviously, gradually, towards the second part of the lockdown, once we knew, once my co-director filmed the hospital baby delivery scene, right? It's natural to say, go back and follow what happened to the baby. That's a natural instinct. The other one being, after we learned Yang Li was keeping all these phones, and she put them so, respectfully onto, in the box and put them away. So I told my co-director, you have to go back and make sure to film that when she called them and try to return those phones. But still, in the end, once I sit down and try to cut it, there's just so many characters I didn't know how to cut. And then, you go back and watch classic documentary film, the early ones, the Frederick Wiseman films. Frederick Wiseman, I drew a lot of inspiration from Frederick Wiseman. It's not about character. It's really about a place, a group, or a bureaucracy. That's Frederick Wiseman's focus. So I drew a lot of inspiration from that kind of approach to liberate myself from not thinking about, and this film needs to be like a real dramatic story. No, just let it play out, to watch these people, because the footage itself was strong enough, was emotionally powerful enough. But with regard to why I decided not to have any narration, it's or commentary, because I think we did interview some whistleblowers. We actually interviewed whistleblowers. We collected a lot of news clips. So I tried to cut in some news clips and interview to give more quote unquote context about this pandemic, about the beat by beat what Wuhan was going through. But to some degree, when I tried that, it destroys the power of the scene, of the human story. It stops the human story. So in the end, I just explained that as I was making the film, editing, my thinking around what I wanted to say started shifting. So, as soon as I realized I want to highlight the common humanity rather than specifically what happened in Wuhan, whether the local government did right or wrong. So I started just taking things out, try to make this film as pure as pure as possible, and focus exclusively on individual human stories, because I want people, despite the subtitle, despite the language differences, I want people to be able to feel it rather than being told what happened. I want audience to feel the panic, the fear, and the bittersweet triumph at the very end, because that's what everybody else outside of China has been going through as well.
Mm-hmm. Yeah. Thank you so much. I think that's very thoughtful. So we have a question for all the panelists. I think this is a very important question for both for our countries now. Are there measures for helping people with their mental health after they have experienced with such a tremendous shock? And I think also like what has been done, like in Wuhan, I think the Director Wu mentioned about people have PTSD, and we can also talk about in the US and other countries as well. So what are the ways that you think that will best support them and help them recover? Maybe we can start with Director Wu first. Do you know any measures that Wuhan?
Yeah, so I know even in Wuhan during the lockdown, there were quarantine sites, like they converted stadiums into quarantine sites. Those were used to house people who tested positive but not showing symptoms. And even for those patients, each site had psychologists on site to help people deal with this. In the hospital, my co-directors filmed that. There were actually psychiatrists as well. They will have talk with them, and the psychiatrist sometimes will prescribe antidepressant, especially for people who lost loved ones. It was very traumatic. I don't know exactly right now what the government, whether there was any systematic psychological help still being provided to the city. But I also know during the lockdown, there were a lot of volunteers in China. So I think, in terms of crisis, you do see a lot of young people in China stepping up. That happened with the 2008 earthquake. That happened this time. So a lot of young people, they volunteer to have, video chats with people under lockdown, not just inside the hospital, but also people under lockdown in the entire city. But then there were so many people willing to do that, to provide psychological counseling and help. But I think there's medical establishment was getting concerned because a lot of the volunteers were not trained psychologists. So they were willing to help, but whether they were actually helping or sometimes they might be actually making these works.
Mm-hmm. Yeah. So Twila, Mike, I don't know whether you want to add to this.
So as a psychologist, but not a clinical psychologist, I can say that clinical psychology in China has grown enormously, but it is nowhere near the amount of people who are trained properly to be able to help with these issues. Also, the PTSD from COVID is continuing, and it's physical symptoms are very easy to see. The psychological effect of COVID in Wuhan, other places in China, other places in the world are very hard to see. And I think they're going to continue for quite a while. So in terms of what best ways might one help, I think the best way in general with mental health issues is to listen and to accept that what that person is telling you is a valid experience and is true to them. And I think that so many times we want to be able to say, oh, it's okay, it's going to be fine. And that may not be actually reassuring or helpful for the person who's going through the experience.
And this isn't my area of expertise, but it's my sense that it's really the healthcare workers who have taken the brunt of the issue here, and they're going to need this type of support moving forward, just to kind of climb out of this and be able to go back to a more normal routine. I think that's going to be critical, because otherwise they're not going to be able to take care of other patients moving forward.
Mm-hmm. But also I'm thinking about like children, right? I think in China, when the city was locked down, I think, all the households, they basically have to remain within their homes, right? They couldn't even get out of their home, and, very, confined place, and for like 76 days, right? And I was just thinking also, like, my own children, I think, when we were under lockdown, at least my children could go outside, right? Play. So I would think, like the impacts on the children, I think that would be probably very long-lasting. But we also got some other questions. I think there's a question about, say, so what do you think about the COVID-19 policy in China now? Do you think it's too strict, or do you see any possibility that China will be open up, especially its policy about international trade and travel? Of course, that's also very much, to our heart, when we will be able to go back to China to see our families and friends.
I also saw another question kind of similar, is about how the US, China's response compared to the US response.
Mm-hmm. That's another one. Mm-hmm.
Yeah, I'm not a policy expert. I just feel like it's hard to draw comparisons. We are very different societies. I mean, the zero infection policy China has been pursuing, there are only a few other places have tried to follow, right? Singapore, Taiwan, Australia, New Zealand. Pretty much everybody has abandoned that. China is the only one. China and North Korea are still the only country still trying to do that. And then we've seen lately there's protest in Australia and New Zealand before they abandoned the zero infection policy, zero case policy. Obviously, there is something about the political system, the way it is, and also the culture, how the community, how the people value collective versus individual, right? Every society pick a point along the spectrum. I think we in the US are to one extreme, maybe China and some other Eastern Asian countries might be to the other, closer to the other extreme. So it's really hard to say. China can do what China has been doing is because the political and cultural reality. We cannot do it here. And also what we value, what each society value, is also, the values are very different. Here, we value human life for sure, but we also put a high premium on individual freedom. and we have our own definition of what individual freedom is here. So yeah, and China is differently. So it's really hard for me to evaluate. Like when I took my kids back to China in the summer, we had to go through 14 days of quarantine inside a hotel room, me and 2 kids, right? Without being able to step out of the single hotel room at all. And, you know, once we get to day 3, day 5, I was cursing. I was like, what the, you know, why do we have to be 14 days undergo like 5 COVID tests? 3 tests enough, 5 days enough? But then once you get, you know, free from the quarantine, you go outside, you feel everybody was so comfortable roaming around. There's no doubt about, you know, nobody worries, very few people worries about cases around. So you can sense that the society in China, they value different things. And then they got different outcomes. And, you know, but by no means when I say Chinese society, that means everybody. Obviously, there are people in China who are unhappy with the policy, are happy about, you know, the COVID reality in China as well.
Mm-hmm. Thank you. I don't know whether, you know, our panelists can offer some thoughts on those, maybe some of the comparative aspect.
You know, I wonder if this had happened, well, if we could kind of change the attitude of the US public back to what it was 50 years ago, but still have the ability to respond the way we are now, if this would have played out differently. Because I think back then, there was more of a sense of the common good and you know, less of a focus on just that sort of individual right. And so I think somehow that's societal bent has evolved over the past 50 years, because it's not the same as I remember when I was a kid. So, but you're right, there's just that contrast. And as I noted earlier, you know, viruses affect society, but society also affects viruses. And so we have to keep that in mind.
We have a specific policy about one of the things. I think it's the last thing in the film, how much time typically would pass between a patient's passing and their family be notified.
Oh, that's a very specific question. So I think in the last scene shown at the beginning of this this talk, Yang Li, the head nurse Yang Li, was apologizing very briefly on the phone to her family. That family didn't even know where their mother was, what happened to her. Because in the ICU, sometimes they couldn't, in the early chaos, some patients would be tried to get admitted inside the hospital. One hospital will be completely filled up, and then they will be transferred to another hospital, So in the end, family would lose touch with the relatives who were sick. And the relatives, once the patients, once they become so sick, they could not even communicate with the medical workers. So the medical workers had no way of communicating with the family. So yeah, it was really heartbreaking when the first call, after a couple months, the first call the family receives about the mother having passed away a while ago, just because that speaks to the chaos. I think it's not every case is like that, right? So for some families, once if they have been in touch with the hospitals, as soon as their relatives pass away, they will be notified. But I think what Yang Li did was really calling people to say, I have your family members' personal effects, right? Okay, you come and pick them up. So it's different from announcing the death to the family.
Okay. Yeah. So thank you. Let's see. Another question is that, so yeah, I think this is a question from audience. I love Wuhan, and thank you so much for making this touching film. Are you still in touch of the frontline health workers, patients, and parents posted in your film? And how are they doing now? And when you went back to China over the summer, did you have the opportunity to meet with them? And how are their post-pandemic lives?
Because I wasn't there to film inside the hospital. So primarily my two co-directors have been in touch with them. And especially Anonymous, who's a photojournalist based in Wuhan. So he's visiting the people he filmed during Chinese New Year, go visit them. I must say this is not my film, it's the team's film. I must give a lot of credit to my two co-directors because they took enormous personal risk, right? To jump in at the beginning of February to start filming inside the hospital because nobody knew how dangerous the virus was back then. That we didn't have enough data. And then they went inside and started filming, putting on multiple layers PPE, just like medical workers. And it was so uncomfortable. They could not even go to take bathroom breaks. Anytime you get out of the contamination zone, you cannot go back in because you only get rations of one set of PPE every day. And then at the beginning is the fear of being infection, physical discomfort. And later on, once they got used to that, it's the psychological trauma on themselves, on my co-director, because they have to film people dying, getting sick, dying in front of them. And then they feel helpless. My co-director, Wei Shichen, for a while, he didn't want to film. He's like, what I'm doing is meaningless. You know, I see people dying. I wish I were a doctor. I could help people. So, you know, I had to say, take a few days off, but later on, go back because we're doing something meaningful. We're keeping a record for posterity. But anyway, so yeah, they are still in touch with the. I think, you know, that's the thing about China. I mean, the young kids in China definitely are very different, right? They're a lot more vocal about their frustrations and emotions. But I think middle-aged and older people in China, this kind of concept of 吃苦, right? Eat bitterness. You just tolerate it. You bear. You work through it. You don't talk about it. So you can see that still. You can sense they're still suffering, but there's not a lot of open discussion about this.
Yeah. So I think that's just the follow-up questions. The audience wonder whether you and your team consider doing a post-COVID documentary to see how the society has changed.
Oh, I mean, there's so many people. My team and I were not doing any more COVID documentary. I think one is, and also at the same time, I think everybody I knew in the documentary space was making a COVID documentary last year because everybody's being locked down, right? I mean, everyone's life was being impacted by COVID-19. So there are a lot more COVID documentaries coming out from all over the world. There are documentaries about Wuhan recovery, which I'm really looking forward to. So yeah, I'm hoping to move on to work on different subject matters.
Yeah. So, and we have a question about the three films that we have featured. We have featured this week. So thank you, Director Wu, for giving us a 3-day trade of your work. I'm curious to learn about your philosophy of making documentaries these days. What does it mean to make documentaries in the age of ubiquitous DIY media when numerous netizens are documenting, streaming, and fantasizing their daily life, be it professionally or amateurishly produced on the social media? How do you understand the genre of documentary when there are numerous timely and non-stop video and reports churned out by mainstream and independent media outlets? Have you considered using social media footages for your own future documentary?
Oh, I think to some degree, People's Republic Desire was built on social media. So if you watch it, you can see I included a lot of clips of live streamers doing live streaming in the film. That's a hard question. I think it's the same thing. Maybe some writers are asking why they still write in the age of Twitter. You could just write a short tweet, get a lot more likes, maybe tens of thousands of likes. And if you write a book, if you get 10,000 sales, you can become a bestseller, maybe in the New York Times bestsellers already, right? It's different. So I've also watched DIY documentaries made by YouTubers. They're actually fascinating documentary. I really enjoy watching those, but I guess we can only do what fits our own value, our aesthetics, that we can only do what we perceive to be worthwhile putting our time and efforts in. For me, is how to tell deep human, insightful human stories in a form that's aesthetically pleasing. You know, I'm still not good enough. I still need to improve. So I just feel constantly challenged by making my next film even better than my past one. So I think that's why I make documentary films. If you want to compare documentary film to these TV shows or social media, TikTok, there's no way, right, in terms of audience reach. But that's not why I'm doing this.
Mm-hmm. Mm-hmm. Yeah, thank you. I think our time is almost up. We have a question. Maybe this is a question for all the panelists, and also opportunity for panelists to make some comments on this. This question is about what are the most important medical and political and humanitarian lessons learned from this global pandemic. So maybe Director Wu and Mike and Twila, each of you probably can share some of your thoughts on this to conclude our conversation tonight. And Rich also, if Rich has something to share with us.
I'll go last on this one.
Okay. Anyone want to go first?
Sure, I'll dive in. I think one of the important lessons here as a scientist is the importance of international collaboration. There was so much sharing of information and technology and such that I think really allowed the world to move out of this pandemic. I mean, obviously we're still in it, but we've made tremendous progress. And I think that's a testament to the scientific and the medical community working together to really, get us towards a common goal. And sometimes even with politics getting in the way, either deliberately or not.
Mm-hmm. Yeah.
I'll go next. So I think there are two things. One is it was and is a global pandemic. And I think that it's all too easy for us to forget that the world is connected and that even in times of lockdown, we were connected in so many ways. The other thing I want to say is that I think everybody was in a hurry and still is in a hurry to go back to whatever was normal, but whatever was normal is changed. And I think it's very important for all of us to keep remembering that and remember those times and those deep reflections that we had time to do during the lockdown and move that forward.
I think that the international cooperation and doing research across the national boundaries is so important. I was very pleased to see in the film ECMO, which is a technology that was invented at the University of Michigan and is being used around the world. But much more importantly, it was the conversations between our doctors and the doctors in Wuhan who helped the patients at the University of Michigan. I also think that the one thing we've learned is how valuable leadership is. And I think the United States has suffered from the lack of leadership, and 700,000 people have died because of that.
For me, I think the biggest lesson is we need to learn to be humble. I still feel like a lot of times, because I live in the US, I've watched both sides pointing fingers, and also I watch US and China pointing fingers. But all of us right now, we tend to think we know the answer, but we don't. Nobody knew. The world is getting more and more complicated with climate change, and there's bound to be another pandemic. It's unavoidable because we are infringing on wildlife habitat. We have to be humble to realize that the only way for us to survive together is by helping each other. Just because, but then unfortunately, sometimes it's saddening to see at this age of the pandemic, we still haven't learned the lesson. Each country is still trying to protect its own borders. Right now, it's using vaccine. In the past, was using lockdown, right, or border control restriction. But hopefully, we can learn. I still, at the end of the day, as shown in the film, I still see in time of crisis, we do have the capacity to step up to help each other. And I hope messages like this can travel wider than the discord that's so prevailing globally right now.
Yeah, thank you all. I think those are really very powerful, important lessons. And I think probably, I don't know, after maybe 50 years or so, people will reflect on what we have gone through, right? How we have been doing during this kind of dramatic time. So, and I will turn this back to Carol and Liang Yu, I think.
Okay, thank you so very much. I think this is such a wonderful way to end the discussion tonight. And I must say, 76 Days is such a powerful film, and the frontline medical workers and all the people portrayed in this film and their loss, their hope, their love and care to each other, and their perseverance and their humor too, all represent the shining humanity in the darkest moment of the crisis. So just a reminder, if you haven't gotten a chance to watch it, or if you just would like to rewatch it after tonight's panel discussion, please follow the event link that we will be sharing again in the chat box. And also such a thoughtful and inspiring discussion about the film too. And thank you to our panel discussants for sharing expertise, insights, and stories. And thank you also to our audience for raising questions and sharing your comments, thoughts, and words of appreciation to Director Wu and his work. So at the end of the film series with you, Hao, I'd like to ask you a question, maybe on behalf of many of our audience. So what will your next film be about, and what's your plan of releasing it? Could you please give us a little bit of an overview and what the timeline looks like?
Oh, you're asking me? Okay.
Yes,
Yeah.
yes,
Oh,
of course.
I'm actually in the process of making all my past film has somehow focused on China or US China, but right now one film I'm working on is how to view China as an integral part of the global network. One of the films I'm doing is tracking a piece of violin as the wood was cut down in the African rainforest, being transported to China, made into violin, and the violin travels to New York and being played by a high schooler in public school. So yes, I think I'm myself have been inspired by the tremendous moving humanity portrayed in 76 Days, which to me is universal. So I want to continue to explore the universal humanity, across the globe that's tied by our violence. So that's a film I'm working on right now.
Thank you, and it's great to know about your plan. So please keep us posted when you're in the final phase of the production. So we would love to host you again, hopefully in person, so that we would love to welcome you back to Ann Arbor. So Carol, would you like to say a few words, please?
Just a ditto on thank you so much, Director Hao and panelists. It has been terrific, and it's been really a fascinating week with such moving films and really excellent discussants. And I didn't watch these films as we often do with the work of a director, one by one. For example, you pause and then you go on later, but I viewed them as a set. I guess I binge watched. And by doing so, I noticed a particular flavor that stood out to me. And that is that notion of connections among people in all three of these films. So people who start off as strangers, but then connect and create new relationships. And within known relationships, as in family, how these connections keep changing. It's really quite a world in flux. And to capture this, I mean, it is it's not easy. And so much is changing in China so rapidly. Your work really captures trends and events, and your work is never done. So time becomes sort of elasticized. You capture what is current and on the cutting edge, but it takes time to create that final product for all of us to see. But just keep doing it and definitely come back and share new work and new art. It's such a pleasure. Thank you.
Thank you.
So yeah, thank you so much, Director Wu, and thanks so much for our panelists and for Rich to join us tonight. And a huge thank you to Liang Yu and Carol for bringing all these things together. A lot of hard work behind the scenes. So, but what a week we have, really kind of blast. So thank you everyone, and thank you for joining us tonight. And I hope to see many of you at our next event.
Thank you all again.
Okay.
Have a good
Have a
night.
nice weekend.
Thank you.
Bye-bye.